Now that we've got a fair idea of what's required from a case manager, we want to know what sort of qualities would be required in someone if they were thinking of becoming or hiring somebody as a case manager. So if you were to hire somebody as a case manager, what's the key things you look out for with them? Either if you're hiring them as a professional or if you were needing to hire for somebody in your own life, what would you look out for?
Oh, okay. Well, experience and expertise.
In relation to what? Is it experience as a case manager or experience as a clinician or?
That's an interesting question. If I was, can I talk a little bit about the British
Absolutely, yeah.
Association of Brain Injury Case Managers? Because I know about that. There are other case management organisations as well. But I was, as what Babbicombe says, which I think is absolutely right, is that you have to have a significant period of working in an appropriate field of work. So if you're wanting to be a brain injury case manager, then you must have had significant experience working with brain injury in your therapeutic life.
So it's experience of the clinical area as opposed to okay.
Yeah. So you need to know what you're talking about, basically. And the more case management experience you have, the better. So if I tomorrow need a case manager, I would prefer to go to someone who's been doing that and has a good reputation, over a number of years. But certainly you need to your initial profession qualifications and registration. Absolutely essential. And then I guess you need, if you're looking at appointing someone to learn to do case management, if that person thinks they know it all already, they're probably not the best person for the job. Okay. Because it's a different skill set, and so an openness and a willingness to learn really are absolutely crucial.
So the willingness to learn would sort of trump a lot of things because, as I said, it is a completely different set of skills than being a clinician.
Yeah, it's a different way, and it's a different way of looking at things. And of course, if you've worked for 10 years or 20 years or whatever it is as a particular kind of therapist, you're going to bring all of that with you. And initially, at least, it's going to be what's going to happen. You're going to start to think, the minute you hit a difficult bit, you'll bring in all the skills that you've used before as a therapist or whatever. So the trick is to learn to take the relevant bits of that, turn it into something a little bit different, and that is case management as opposed to therapist.
Have you? We've obviously worked with other case managers you came from a speech and language background. Have you worked with other case managers from different backgrounds?
Yes, I have.
What I'm thinking about is, I know speech and language has taught in the social model, whereas some other backgrounds are taught in the medical model, which is I know better, you do what I say. Without sort of pointing fingers, is there any type of background that you've noticed tends to find it harder to adjust than others?
That's the tricky one, because I think so much depends on individuals. I think the people who want to go on and have got to a point in their career where they want to extend and move on are not likely to be the sort of people who want to tell someone what to do.
So you basically want the Michelangelo type people who said, I'm always learning.
Yes.
And if somebody is a clinician in their current job, so they pick, say, for example, an OT or a nurse, and they've got 20 years or so under the belt, and they thinking about the change they'd like to make, what would you advise them? Like, what steps would you now in hindsight say to them, well, if I'm doing it again now, I would do this, this, and this? Like, what would you tell them to do, like 2 years before they make a change, 3 years before they make a change, or how
Wow,
they do
they'd
it?
be very well organised and very well planned, but that would be good. I guess always if someone's thinking about making a change, go and think again about it. Find out as much as you can, and try and get some experience of. It's not always easy, but work alongside someone if that's possible, because what you think it might be might be a little bit different to what it actually is. So I guess it's do your homework as far as you can. Talk to as many people as you can. That's best.